Hello, everyone, and welcome to Headwise, the videocast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel. I'm the founder of Migraine Nation, and I have a history of chronic and daily migraine that began at the age of 4. Today, I'm lucky to have Dr. Lauren Natbony on as our guest. Hi, Dr. Natbony, how are you?
Hi, I'm good, thank you. Thanks for having me.
Thanks for being here. Dr. Natbony is a board-certified neurologist and headache specialist. She is the founder of Integrative Headache Medicine of New York. She is also an assistant clinical professor of neurology in the Division of Headache and Facial Pain at Mount Sinai's Icahn School of Medicine. And what is important for our purposes today, she happens to be a licensed acupuncturist. Our topic today is acupuncture and migraine. And this is a really interesting topic because people have asked me previously to cover this topic, and it was a little bit difficult because it's not something we have a ton of data on, and it's not something that there are a lot of people out there that are experts in this area that I can interview. So I'm very excited that I found you, and we're going to cover what is known about this topic. So before we begin, I would love it if you could tell the audience a little bit about yourself and why you've chosen to work in the field of headache medicine.
Absolutely. Well, thank you for that wonderful introduction. So, I just love headaches. So, I feel like how I got here is family. My mom suffered with really bad migraine all growing up. I just remember having to take care of her, putting her in a hot shower, bringing her medicine and ice packs, and just really never addressing it. I know even now as a headache specialist, I'm like, Mom, why can't I help you? I feel like parents maybe are that way. But then
Right.
also I started developing migraine as I got older. And I think part of a reason why anyone I think becomes a doctor is to understand medicine, also understand themselves, understand family. So I was just always trying to figure out why and how could I help. So naturally, I love the brain, went into neurology, but headache was always really a special place in my heart. And I feel that headache is so misunderstood and
Hmm.
that there's just so much that we can do, both with medication, with things like acupuncture, just this whole array that is just not really well presented to the patient. And I just feel like it's just such an art as well as a science. So headache is kind of my whole life and I love it. I couldn't imagine doing anything else.
Well, we are glad you're here and we are glad that you chose this field. So, can you start this topic by just telling us what acupuncture really is and the theory behind how it might work for things like pain and inflammation, etc.?
Absolutely. So, just generally,
Hmm.
acupuncture is a technique that involves the insertion of really fine needles into specific points in the body. And these are thought to regulate the flow or balance of energy. And energy in traditional Chinese medicine is called qi. So, what the thought is by taking these really fine needles, you can regulate the balance of how qi or energy flows through these meridians or pathways in the body.
Hmm.
So acupuncture points or sites where needles go are areas where qi might be out of balance. So certain disease processes can cause qi to either flow well or not flow well. So when you needle in a certain area, you might remove too much energy in an area that might be congested or add more energy where there's a deficiency. So it really is based on this meridian system, of which there
Hmm.
are different meridians running through the body, and then balancing the energy through them.
Okay. So the first thing that I've noticed that people with migraine will often say when you bring up acupuncture is, I've had trigger point injections. Is it the same thing? Can you answer that?
It's a great question. It is not the same thing. There is dry needling that an
Hmm.
acupuncturist can do, which are to break up the tight bands of tissue. Acupuncture has nothing to do with muscle or tightness. It's actually putting needles in specific points on these channels that don't
Hmm.
necessarily relate to where you feel pain. So, for example,
Okay.
someone might have pain here, and I'm putting a needle in your toe.
Hmm.
It's for a regulation of energy flow, not to break up tight bands of muscle and tissue.
Okay. So let's get back to the data. I did quickly mention that one of the reasons it was difficult for me when I first started working on the podcast to do a podcast on acupuncture was there wasn't a whole ton of data out there necessarily about it. So, what kind of data do we have now for the treatment of migraine with acupuncture? Is it even possible to conduct a robust clinical trial on acupuncture?
Yeah, that's really been the problem. I feel like we do have data, but most of the data is looking not so much at clinical trials, but sort of, I don't know, it's like this conglomerate of and review of other ones that have been done. I feel like if we look at who has been the biggest one who's published, Lindy is one who has published a lot in this space. And there have been a number of Cochrane reviews that have been published, but one in 2016 that basically reviewed 22 different trials with like 4,000 participants and basically compared acupuncture to sham, which we can talk about sham acupuncture, which means like placebo, because sham is
Mm-hmm.
never really sham when you're talking about an intervention. And then also compared it to routine care and then to other prophylactic medications. And this was sort of the biggest trial that we have for acupuncture and episodic
Mm-hmm.
migraine. And it basically showed that acupuncture was similarly effective to treating with prophylactic migraine-specific medications, more
Mm-hmm.
effective than sham or placebo. But again, how much more effective than placebo it was, it's not super robust, but
Okay.
similar to medication. So sort of the takeaway from that, and again, I'm talking episodic migraine, is
Right.
that if it's comparable to pharmaceuticals and has less side effects, and people are more willing to comply because they don't have side effects from medication, then why
Mm-hmm.
not offer it?
Right.
So, in terms of like evidence for episodic migraine prevention, acupuncture has the best evidence in the migraine space, but I will say it is not superior to pharmaceuticals. It is similar. So take that as you will. I always believe in a combination approach. So
Right.
actually doing both together, again, data might not be there, but I feel like if you're someone who's hesitant about being on medication or who has side effects to medication,
Yeah.
acupuncture, the evidence can be similarly as effective.
Okay. Were there certain people in the trials who it helped more than others? Like I think you were focusing on episodic more than chronic there,
I could
or
talk
did it help men more than women? Anything like that?
Yeah, so that those specific trials were episodic. Chronic migraine has been a lot less studies on it. There were a few, but they haven't shown as robust of an improvement. And obviously, it's harder. It's harder in a chronic migraine population. But
Mm-hmm.
I think the studies have shown that results are comparable to medical therapy. But again, we have small sample sizes. I think the follow-up periods were pretty small. They only looked at about 3 months. So the long-term efficacy in chronic migraine wasn't as well known. But
Mm-hmm.
I would say it still can help just because we don't have the studies necessarily to support it, doesn't mean that it's not going to be helpful.
Right.
Studies themselves don't necessarily say which patients aside from episodic chronic it will be more helpful for, but in
Mm-hmm.
practice and in experience it tends to be the patients who are able to commit to doing it and have an open mind. I know it sounds silly, like you have to actually think that it can help in order for it to
Mm-hmm.
help. And
Right.
we've seen that having that open mindset and sort of just ability to relax with the procedure does influence the results and the impact.
Okay. How about kids? Those of us who have children with migraine know that it can be difficult to get certain medications for them. So I'm just wondering, can pediatric patients undergo acupuncture? And if so, has it been shown to be helpful for migraine at all?
Yeah, I love this question. So, yeah, it's actually not robust evidence, but acupuncture can be helpful and has some evidence to show benefit for
Hmm.
migraine in children. So, it's something that very few people will practice. So, I think finding a practitioner to do it might be
Right.
the rate limiting step. But I do think that using it as a therapy when medications, there aren't that many that are great in kids, they aren't
Right.
necessarily that well tolerated. I think if the time is there to dedicate to doing acupuncture and the child is open to doing it, I do think evidence can support moving forward and trying it.
Okay. Has acupuncture only been studied for migraine prevention, or has it been looked at in the acute setting? In other words, I have a migraine and I'm going to get acupuncture. Can it help?
Yeah, there's been multiple studies showing that there's some benefit for ear acupuncture, so auricular acupuncture for acute migraine relief. The longer term benefit wasn't really shown in those studies. But
Mm,
overall, aside from ear acupuncture, there's really no evidence to recommend that acupuncture in general is effective for acute migraine treatment. And the reason why, in my opinion, is how do you do a study? It's really hard to do a study of getting someone to an acupuncturist at the
right.
time that they're having an acute attack. And in practice, how practical is it? I will say, as someone who does acupuncture, even if a patient calls and is like, you know what, I'm having an acute attack, getting them into the office to do it in that setting
Hmm.
is hard. So I think unless we had acupuncturists in emergency rooms or in urgent cares, it's a hard thing in practice to really
Right,
do. And I would say to translate that then into getting studies on it, the studies therefore are limited.
right. Is is acupuncture effective for any other types of headache or chronic headache besides migraine?
Yeah, so tension type headache, there are trials that have shown its benefit in both chronic and in episodic tension type headache. And
Okay.
actually, there was a 2022 study, I believe, that showed benefit for acupuncture for chronic tension type headache. That was a longer term assessment. It basically looked at it over nearly 8 months, and it did show that it had benefit over a more prolonged time period in that
Okay.
population. I think chronic tension type headache is one that is more challenging to treat. So I
Right.
would say secondary to its evidence for episodic migraine, I would say if you are someone with chronic tension type headache, it might be worthwhile to explore. In episodic tension type headache, there was a small but still significant reduction in headache frequency versus sham acupuncture over a 6 month period. So in that population, it can be helpful as well. So I'd say tension type headache, another good population to try acupuncture. Cluster headache, only come across case studies. There really isn't that much. That being said, is it going to hurt? Probably not, but I don't have much evidence to support it. For
Okay.
cervicogenic headache, there is small evidence. There was one study that showed the combination of massage with acupuncture for cervicogenic headache that showed benefit. So I think there is definitely room to put acupuncture into the treatment algorithm and cervicogenic headache as well.
When someone is receiving acupuncture for migraine, for another type of chronic headache, how often do they receive treatment and for how many sessions do they go?
So this is where the rate limiting step I kind of feel like is, because most studies looked at doing acupuncture once or twice a week over 8 to 10 weeks.
Oh, wow.
And that is a commitment. So a lot of
Hmm.
times I find we try something, right? Like we all like, we're going to try it and we're going to like give it our best effort. But then if it's not helpful after a few times, it's sort of, okay, do I continue or not? And that's where I find in clinical practice that things can fall off, just like with anything that takes time to be
Hmm.
beneficial. But yeah, so I would recommend doing 1 to 2 sessions a week, ideally two for at least 8 weeks. Um, you can also, there are a few studies that look at like 8 to 10 sessions. So if you're doing 2 sessions a week, it could be over 4 weeks. But if you're going to do one a week, I would say 8 to 10 weeks.
Okay. And is that covered by insurance?
So I would say look at your plan. So surprisingly, there are some plans that do cover acupuncture.
Okay.
It is a benefit that comes with some. So if you don't know, definitely asking your insurance if you
Okay.
have acupuncture coverage.
Okay, great. Is there anything that we've missed? Anything else you'd like to add on this topic before we go today?
I feel that acupuncture doesn't get that. I feel like we all think about it, but I don't think we necessarily integrate it into practice. And I just want to say it's important to set expectations, right? I feel like with anything, the less severe the disease, the easier it is to treat, the more
Hmm.
chronic, the harder. But I find that for patients who have insomnia, who have a lot of musculoskeletal pain,
Ooh.
who are just more stress, which I mean, come on, we're all more stressed. Acupuncture can help regulate the autonomic nervous system. It can help
Mm.
sort of calm things down and it can be relaxing. So while it might not directly, let's say, for some people work for migraine, the benefits it has for those other conditions that we struggle with when we have migraine can still give an overall added benefit. So I think we need to look at metrics, beyond helping pain, but helping sort of the migraine brain as a whole.
Right. Like I always tell people, it's never just one thing. You might have one thing
That's what
that
I said.
really helps, but sometimes it's the 10 things that you were doing before that let that one thing help a lot. So, I add a lot of things into my treatment plan, and I'm so much better than I was 15 years ago, but I'm doing 100 things that I wasn't doing then. So it's never just one thing. But I love
Never.
the idea of, you've got your preventive medicines, you've got all these things, and maybe acupuncture is one of those things that's going to help you. So,
So, yeah, I feel like I always say it's never just one thing.
yeah.
So I completely agree with you there. I also just want to plug a little bit on how acupuncture, even though we always talk about needles and someone else doing acupuncture, there is acupressure. There are techniques that can also be learned at home. Are they going to be the end all be all of everything? Probably not. But I find it for myself sometimes to be pressing on the acupressure points to be effective. There are other techniques that we can access these points at home and can teach you, and acupuncturists can teach you strategies at home to do in an acute setting. So I think even beyond just going 2 sessions and getting acupuncture and needling, there are techniques we can take away from that. So I just want to say there's more than just what meets the eye when it comes to acupuncture. And I think it's
Right.
something, if you're interested, it's worth it to explore.
Right. All right. Well, thank you so much. Thank you for being here. And thank you everyone for joining us for this episode of Headwise. Please join us again for our next recording. Thank you so much. Bye-bye.